This is Brian Wormers recording a lecture for medical surgical nursing on respiratory infections. And on this one, we're going to be talking about tuberculosis, or better known as TB. This is a communicable disease caused by Mycobacterium tuberculosis and is transmitted via aerosolization. This means that this is a true respiratory type of thing and it's an airborne route, meaning that if you're caring for somebody, you should probably have an N95 mask, or you should have a PAPR, which is a powered air purifying respirator. It looks like a great big spacesuit, but it keeps you safe. So with these patients, what happens is that there's multi-infected bacilli that become active and infect the lungs. Oftentimes, they start out as having what we call active TB, and then this turns into a latent TB. So patients are contagious only when manifestations are present, and then after treatment, they are not contagious anymore. So for assessment, so some of the big things is with TB, it's often very broad and non-specific for what's going on with them. But some of the big things that you'll see are that they've got a history of travel to foreign countries or places that have TB, and then they're going to report some night sweats, some fever, lethargy, sputum, maybe even some bloody sputum, weight loss, anorexia, just not feeling good or hungry, and then having some regular menses with this. Be aware if they travel to other countries or if they've had vaccinations in other countries such as the BCG, they will become positive if you do a skin testing, a Manitou testing for them. So that's something that NCLEX loves to test on, is that somebody that was born in a different country had the BCG vaccine and is now positive on a Manitou. What do you do? Since they were previously exposed to it, it's an unreliable test now with the Manitou. And so you really need to go the gold standard, which is a quantiferin gold. Otherwise, get x-rays done. So there's testing that we could do with this one. So we can do blood analyzing with the quantiferin gold, like I mentioned before. Otherwise, we can do, there's a new rapid NAA, which we can do. Otherwise, we can do the Manitou, which is cheaper, but it's not as accurate, number one, and number two, it requires that you have to go in, get it placed and get it read, and a lot of places are even saying now that you have to have it done twice, so it's even more inconvenient. So with the Manitou, you know it's positive if you've got a large induration, depending on the time frame for when it was given, but like I said, it's kind of losing favor with some people. The other thing you can do is get that chest x-ray and looking for any active lesions. So here's showing an arm that apparently had a Manitou placed, and that, look at that circumference, it's definitely big. It's greater than 1 centimeter. So planning and implementation, so interventions for this one, it's a combined drug therapy. Oftentimes what we're using is INH, rifampin, and then we're including pyrazidine, which is not necessarily a med, for treatment of this, but based on some of the side effects. And then we could also include ethambutol. So be aware that with some of these meds, there are some side effects that you have to be aware of. Ethambutol does not play nicely with alcohol, so they should not be drinking during this time. You should have increased fluid when you're taking that pyrazidine. Rifampin stains things yellow. I've got some examples of that one if you're curious later on. But this includes everything from your tears, so it would stain your contacts, it will stain your pillowcases, it will stain your bedding, it will stain any t-shirts that you wear. So all of your sweat, all of your tears, any secretions that you have, it turns a wonderful yellowish color or orangish color. Some of these meds are not nice on an empty stomach, so make sure that you take them with some food, and make sure that you've got strict adherence with this. Oftentimes we say that they have to have a DOT, so direct observed therapy, meaning that somebody has to watch them take these meds and make sure that they are taking them when they're supposed to at the approved times. So some other interventions, so convalescing most occurs at the home setting, so oftentimes we get them stable enough to go home, and then at that point in time, um, they recover and they're on these antibiotics for a long period of time. Initially, we'll do sputum specimens. This says every 2 to 4 weeks, just to make sure that they go into remission or latency. After they have 3 negatives, then they are no longer considered to be infective. So this is saying once again with the direct observed therapy, and we kind of talked about that earlier, as well as talking about the airborne precautions. So you need the special masks with this or that PAPR device. This is going to conclude this lecture on TB. It's just a tip of the iceberg on TB, but if you have more questions, please make sure you ask. Bye.